Hey everyone, welcome to a new episode of the AI Best Business Show, the show where you'll best learn about business, tech, entrepreneurship, and anything that makes money. Today I have with me Zahir Nasser. He's a great founder uh, involved in the entrepreneurship community. I'll let Zahir introduce himself. Zahir, welcome to the show.
Thank you very much, Ahmed. It's a pleasure to be here.
Uh, Zahir, I'm gonna ask the introduction question in a different way. Let's go with what was your first attempt at entrepreneurship? Like at what age did you go ahead and like start a small company or start thinking about entrepreneurship?
Yeah, so growing up, I was I was part of family that was always very business focused. I was helping my father from a young age with his businesses, so I was always exposed to business in some shape or form. My first business was around the age of 14 or 15. And this was at the time I was very passionate about uh, seeing how things work, and I used to break computers apart and put them back together. And I found that I had a knack for it, so I started to build computers for people, service people's computers, set up business networks, and yeah, that was my first attempt. So
Oh wow,
it was
okay.
a very young age.
That that's did the breaking computers and sending them to people like putting computers together go far with you, or did it just end at a young age?
So yeah, I was involved in this for a number of years after. During my college university days, I continued this, and I actually joined forces with the local computer shop in the area that I lived, and we worked together in growing this further. So I'd help them out. They'd provide me customers. I'd provide them customers, and it's just an amazing opportunity.
Okay. Um, Going from the start of entrepreneurship, uh, you now work in the kind of or are involved in the health tech industry or the healthcare industry. And before we jump in on what are you doing or what are you working on, I would like to understand, uh, like in the MENA region and you're working in the UAE now, is that right?
That's correct.
Yeah.
Yes.
And so in the UAE and the MENA region in general, where do we stand now in terms of the health tech and health industry?
Yeah, it's a great question. I think it's amazing to see the support from government regulators in actually developing an ecosystem for health technology. We've seen in the West, I come from the UK, and we've seen huge initiatives behind uh, government health services there trying to go digital. And despite billions and billions of pounds of investment, there's not been a huge impact. The only difference I would say is that has occurred is it's helped with very basic things like pharmacy deliveries, like getting an initial consult with a doctor for something small. But anything that's traumatic, anything that's more chronic, um, that doesn't really work in that region yet. But here we've seen immense support for a centralized health exchange, multiple centralized health exchanges in the various emirates in the UAE, and this has enabled collaboration. This has enabled the sharing of data. This has enabled so many opportunities for individuals to know their health better. Um, I have an NHS record in the UK, and I log into it and I see nothing. I log into my health exchange record here in the UAE, and I'm seeing 5, 6 years worth of history at minimum. So
Wow.
it's amazing what's being done, and it's just the start. We're seeing a huge amount of support from the various regulators, a huge drive from government investment funds to support the evolution of healthcare. It's going to take time still. Healthcare was when I started my healthcare journey, it was a good 20 to 30 years behind every other industry and innovation. I think since the pandemic, we've definitely accelerated that by 3 or 4 years, maybe five, but
Okay.
we're still behind. There's still a long way to go.
Okay. Here's a question I have. What you just mentioned is that kind of in the UAE or let's speak about the Gulf region, GCC,
Mhm.
compared to UK, where you come from, or maybe sometimes even the US, the GCC is tending to be ahead of the game from these leaderships countries in terms of like some industries. And why do you think we don't have enough coverage of showing that, oh, like we have a good health tech industry that's coming up compared to the UK or the USA?
So there is still some level of stigma, I think, between using a digital solution versus what most people still prefer is to go physically. But those who um, are busy and don't have the time to go to a hospital, they're seeing the most amount of impact. Being able to, for example, get a blood test at your house, get your medicine delivered. Um, these are very basic things, but it has a huge impact on doing a health activity versus not doing a health activity. Um, in the hospitals and clinics that have high demand, sometimes it's difficult to get an appointment for a couple of weeks. So it's having access to alternative services is huge, and I think the reason we're seeing adoption is really because um, there is coverage on certain things from an insurance perspective. So there's been adoption for some health providers, primarily in the primary care space, to offer insurance coverage for digital health services. It's still, again, a long way to go. I think we need to get people educated on the pros of having healthcare in their pocket rather than having to physically go and make people comfortable with it.
Right. Um, why did you choose healthcare? We spoke about the industry lays in. Why did you choose that sector specifically?
Yeah, this is a question I get a lot of, and I'm not a doctor, I'm not a medical professional. I do have a lot of family in the healthcare space, but I started this journey in probably 2016 or 17 when I applied to participate in one of the first accelerator programs in Abu Dhabi as part of the New York University Start AD program. And when I went into this, I thought, what do I want to do? And I spent some time doing a bit of research, and I'd always been interested in healthcare. I was before I left the UK, I was planning to join a chain of nursing homes to learn the industry, and we're looking at acquiring some nursing homes
Okay.
and taking them from dormant status to active again. So I always had an interest in healthcare, but when I did my research in 2016, I realized that healthcare is so far behind every other industry. When we look at other technologies in the transport space, in the education space, looking at how even government services in the region have evolved since the time I've lived here, it's been amazing how much digital transformation has occurred. And healthcare seemed to be far behind.
Okay.
It wasn't just the case here, it was everywhere in the world. The numbers that were being quoted was 20 to 30 years behind every other industry. And this intrigued me because um, good health and well-being is, to me, it's essential to a healthy nation. And the fact that we were seeing a huge increase in lifestyle diseases globally, locally, was huge. Increasing at ridiculous rates on a yearly basis. I thought that there had to be a way to do things better and get people to live well rather than with sickness.
Okay, that makes sense. Uh, you're working on Doctori right now, or before you started working on it, what were the gaps you saw in the market? Like what pain points you saw in the market and what were the conversations you had with the people surrounding you about this idea before you started it?
So yeah, locally I actually run a company called Doctori Connect. It's a subsidiary of a UK entity called Doctori Limited. The conversations were really around understanding individuals' approaches to managing their own health and wellness.
Okay.
So I actually got involved with Doctori actually later, just before the pandemic. We It was early 2020 when I started working with Doctori, and then we started Doctori Connect very shortly after that. And it was really understanding that one is getting access to the best doctors was limited to your insurance coverage. So how do we make care equitable to all? How do you get healthcare the same as the person who has the best insurance? The second was around the idea that the healthcare system typically is reactive to when we feel pain, when we've gone through trauma, rather than actually managing our health and wellness before we get to that stage.
Right.
And I saw a huge need for that because we were seeing this huge increase in diabetes, heart disease, everything else. And that's where I started to focus on the areas that most healthcare providers were not.
And this is something interesting you mentioned is I think insurance companies in general, health insurance companies, would want to work with like practices or startups that deal with preventive diseases part, with like the part before you get sick, because that helps them reduce their cost. It helps the human himself deal with preventive measures before he gets sick. So it's an interesting area to look into and think about. Now, what is Doctori?
So I'll talk more about Doctori Connect. It stems from Doctori, which Doctori, if I go back, was originally a platform designed for the Arabic-speaking world to get access to the best medical knowledge and education. So we had a coverage of over 3,000 articles. I wanted to take this further when I became part of the mission and implemented my own vision of what I wanted Doctori Connect in Abu Dhabi to be. And that was around the theme of originally functional medicine, because this is an area of medicine that addresses disease through the use of nutrition rather than medicine. So we're looking at how does the food that we eat affect what we get out. And the analogy I like to use is we've all at some point in our life, some of us at least, have by mistake put diesel into a petrol car. Especially if you live in the West, it's very easy to do. But very quickly after you do that, your car starts to stall. The same way, our bodies, if we put the wrong food into our bodies have a reaction. And very frequently we take medicine that we're prescribed, this tiny little pill, and we know that pill will solve a health challenge because it's proven, it's science-backed, it's evidence-based. But what about that massive burger? Like, we're putting that into our system, not realizing the impact that has on our body. Both are chemical compositions. One has a healing property, one has the ability to destroy cells, and so on and so forth. So looking at nutrition closely, we thought, how can we solve health challenges using the right food?
I heard a podcast just recently. I'm coming up with the name of the doctor that spoke on the podcast, and he speaks a lot he's a heart surgeon, and he speaks a lot about like what causes heart diseases, speaking in terms of processed food and whatever we enter our body. And he goes into depth with what you were just speaking about, that what we put in our body is a huge cause of what diseases we get and what side effects we get later on. So again, going back to this same point of preventive methods of the body in general. If I'm a patient and I'm going on Doctori Connect, what do I get? Like, what are the services that I could jump in and see and receive from the platform?
Yeah, that's an awesome question. So we've partnered with local labs in the UAE to actually provide diagnostic testing for nutritional elements. So food intolerancies, vitamin deficiencies, mineral deficiencies, other nutritional deficiencies in your protein intake, fats, carbohydrates. We can measure that, and there's a framework by the Institute of Functional Medicine, which we follow, which allows us to measure that and basically modify your diet based on where you stand now. So if we know, for example, that, believe it or not, I think 60 to 70% of the population are probably lactose or gluten intolerant, but how many have actually been tested? Maybe 5%, 10% at most. Funnily enough, I found out recently that I was both intolerant to both, which is incredibly common. You wouldn't believe. Like you hear of people being lactose or gluten intolerant, but to be both, I thought was very rare. But I found out recently that actually a large proportion of people are intolerant to both, which rules out, even when you're trying to avoid certain milks, for example, makes it very difficult, because even if I wanted to go dairy free, I have to find gluten-free oat milk.
Oh wow.
It's really
Okay.
difficult. It's available, but it's hard to come by. So first of all, we offer testing, and then we offer the access to functional medicine trained health coaches. These are literally there to hold your hand on your journey, on your health journey, to help you basically handhold you to better health. In addition to that, if people wanted to get access to a clinical nutritionist, we provide that. And for very rare and interesting cases where there's a lot of deeper health issues, we also are working towards onboarding functional medicine trained physicians to provide deeper testing and understanding and support for individuals.
Okay, so what you're basically focusing on is mainly nutrition caused diseases, right? Are there any other areas you're tackling, or is it just these areas that you're tackling?
So from our perspective, everything is nutritionally caused. There's nutrition, and there's a few other areas. There's environment, there's genetics, there's there are a bunch of other areas that cause disease, but we're looking at solving it using nutrition. So it's not necessarily a certain disease caused by nutrition, but it's how do we solve most of the health challenges with nutrition.
So for example, let's say I have a skin disease and can I use Doctori Connect?
So yeah, I mean, most skin diseases are a result of a nutritional deficiency or a food intolerance. Maybe you're sensitive to something. I noticed this actually a few years ago. I didn't have a food intolerance test, but I noticed as I experimented with being vegetarian for some time that certain red meats caused a rash on my arm.
Wow.
And as I started to cut that out, I started to see it disappear. So that was one of the early signs that led me to think about nutrition as a solution to most problems.
Okay.
There are.
Go ahead. I'm sorry.
Yeah, sorry. There are obviously certain situations that are traumatic or have gone too far, where you need interventional surgery. If somebody's grown a tumor, there's no point trying to treat it with nutrition. Now we need to actually have a surgical intervention. But then what we can do with functional medicine is improve the outcomes and the recovery by adjusting the nutrition to ensure we give the individual better energy, improving his quality of life during that stage. And overall, it's better health while you're on your road to recovery. And it's been proven using functional medicine that the outcomes for example, cancer patients, using functional medicine as a tool to recover faster, the research has been done, and it's very promising.
Okay. To make the viewer understand more, let's take a specific use case. Let's take a specific patient coming on, doing a test, and the process of taking him hand in hand till his recovery journey. Want to give an example? Feel free to give any like use case you could think of at the moment of going from A to Z of me as a patient going in and using Doctori Connect to the fullest of its services.
So I would love to use an actual case study, but we're a very
Okay.
early stage. So I wouldn't be able to give a Doctori case study. But from what I've studied and understood, there are cases where diabetes has been reversed. There are cases where certain types of heart disease has been reversed. And using nutrition for, as I said, for cancer recovery and other areas has proven to be very successful. I think what we're trying to do is basically digitalize that user journey, because ultimately we're a technology startup.
Okay.
We're not a clinic, we're not a hospital, although eventually we plan to acquire a healthcare practice license so we can potentially open digital clinics around the country, and offer these services more holistically. Right now, the way that we operate is we partner with registered healthcare facilities to deliver
Okay.
our services as a technology company, but eventually we'd like to be the healthcare provider.
Okay. Who's your average customer? Is it young people that you see using the platform? Is it older age people?
So we've been very fortunate to have a good cross section so far, with the users that have expressed an interest and have worked with us. We're working on a couple of proof of concepts with some government entities that we're partnered with to actually deliver our solution for senior citizens. So we're going to be testing this with a mixture of different diseases, and both well and diseased patients or individuals with diseases, and seeing how we can actually improve their outcomes, reverse disease, help them live more vibrant lives, be more active through the use of functional medicine. Right now, because we're not really insurance covered, we see a lot more of our customers are the type of people who already spend money on their wellness.
Okay.
So people who pay for, good gym memberships, people who use things like cryotherapy and IV drips and are actually experimenting with their health. And you'll be surprised, there's a lot of people who are very health driven and focused. So
So there's a market out there.
huge market.
That's okay.
Yeah.
Okay. I want to get back to just this general idea of telemedicine, which or digitization of medicine. In your opinion, what are like what are diseases that could be solved through digital medicine or telemedicine? Not all diseases or not all stuff could be solved, I'm assuming. So what are your thoughts?
So I've always thought that the only diseases that can be, or health conditions that can be solved by telemedicine is anything that doesn't require an examination. So
Okay.
if I need to see a skin condition and I need to actually look at it, you're not going to see it on the video effectively enough to really. It comes down to, does the user have the best
Right.
video quality in his camera? Is it color adjusted? All that kind of stuff, which, yes, the doctor can identify vaguely what it is, but usually when he or she sees it, they're gonna think about it a little bit differently. So it's always better for certain things to be done in person. I think where you can generally go through a diagnosis process, for example, things like headaches, where is the headache located? How does it feel? If the patient can describe it effectively enough, that can be diagnosed through telemedicine. So anything that requires a deeper examination, requires the physician to actually feel around the patient. Unfortunately, you can't do that via telemedicine. The other thing is, very frequently they need vital signs, does everyone have a blood pressure monitor at home that they can use to report their blood pressure to the physician? Thermometer, you'll be surprised how many people don't have a thermometer home. They might have one in their kitchen, but they don't have one for the body. So it really comes down to, technology. Do you have the technology available? Now, obviously, some people wear a wearable which delivers some of this. I can tell I can do an ECG on my Apple Watch. I can do body temperature. I can do the O2 saturation. I can see my heart rate. So there's a bunch of things you can do with some basic technology, but we're still a long way to go before we get a penetration in the market of people that have access to the tool needed.
Right. Would we ever get to a day where 80% or 60% of stuff in healthcare are digitized to get this full package that you just spoke about?
I hope so. And for us, that's really the vision of the future. I should only have to go to a hospital if I'm dying. If I've been in a car accident and I've broken a limb, or for the basic stuff, we should be able to diagnose at home, speak to a doctor, and get to the bottom of it. There are companies that are creating at home mini blood labs. You can run some basic blood tests at home with a finger prick and a few drops of blood. So there's no reason why not. And I definitely envisage a future where that could be possible.
Okay. How do you make sure you're working with the right doctors or the right practitioners?
Yeah, that's a very interesting question, and I don't know yet. I hope that the doctors that we speak to, that work with us or advise us, have a passion for making a change.
Okay.
So they're not your traditional doctors who've qualified 30 years ago and refused to change. They are looking at, how can we make people's lives better? How can we make people live healthier? And they definitely acknowledge the fact that, the hospitals and clinics have become burdened with, the volume of users, because they actually haven't imparted enough education previously. Schools and don't teach us enough about our health. So it's really going to take people to know their health better. We like to say that, the individual is the best physician for himself. And actually the meaning of Doctori is my doctor. And we're empowering people to be their own doctors. So
okay.
I am my doctor,
And so we could think about the general idea is people who really want to take care of themselves before they get sick, before they get a disease. It's this whole preventive method. And when I ask how do you make sure you're working with the right doctors, is more of some doctors are really driven by, okay, I'm going to get a patient in their prescriber medicine, maybe take a percentage from the pharmaceutical company for describing this medicine for that patient, perform a surgery where I'm going to make more money. Some doctors are driven by this. And this is why I wanted to ask, how do you make sure you're working with vetted doctors that align with you on the same mission?
Yeah, it's really down to mindset. So we tend to be able to have great conversations with doctors that see that. I like to share a story. I went to the doctor a few years ago. I used to get a throat infection twice or thrice a year, and I'd always get the same antibiotics. I went to see a doctor once, and he literally didn't look at me. He asked me what was the problem while staring at his screen, asked me a few more questions, and then handed me a prescription, and didn't even tell me what he thought was wrong with me. Now, I knew what was wrong with me. It happened often enough in my life. But I made it a point to say to him, do you not want to tell me what your diagnosis is? And that's the only time where he then turned around, looked at me, and gave me my diagnosis. And that's when I said, this happens to me 2 or 3 times a year. What can I do to prevent it? He's like, nothing. You can't, you just have to live with it. And I'm like, this happens a lot. Like, surely there is something underlying, within me that's causing this. And he couldn't give me an answer. So I absolutely respect the training and the dedication that doctors have done to get to that point. They've spent years and years in educating themselves, but the doctors that have the right mindset, that actually take the time to talk to you, that actually want to help you understand what's actually going on with you, those are the doctors that I think I see a place for them in the future. And definitely, we're seeing shortages globally on doctor numbers, staffing
Right.
numbers, and with the increasing population, this is only going to get worse. So it's really now that people need to take ownership of their health, an active role in managing their own healthcare. Because God forbid, 5 years down the line, it takes you 3 months to see a doctor. What are you going to do as an individual?
Okay. What is your 10-year vision for Doctori or Doctori Connect? Like, where do you see it after 10 years? If we're having this podcast again, what would we be speaking about?
I mean, that's a very interesting question. I first of all hope we're still around, because my vision is very long term. We're looking to make an impact in healthcare. We're looking to help change people's lives. So I hope that first of all we're still around to be able to tell a story about what we've done over the past 10 years. But most importantly, I would like to say we've impacted millions of lives. We've helped people live better. We've avoided disease in X million number of people, and we've just generally made a difference to humanity.
How do you plan on penetrate, like to have this effect? You need to penetrate markets such as now you're in the UAE. Think about penetrating Egypt as a country, let's say in the region, or countries that Syria, Lebanon, penetrating these countries with people who are maybe in terms of financials less able to access these type of services, in terms of education maybe less ability to tackle these type of services. How do you plan on penetrating these type of markets?
Yeah. So first of all, I think getting some level of scale in the UAE is important to prove that our model works.
Okay.
So once we've proven it in the UAE, we can take that data and we can get the support of authorities in areas like Egypt and Syria and Lebanon and Iraq, and in countries that either have no access or limited access to good care. Our vision for these countries is very much partially, obviously, to make money, but we want to also provide access to people who don't have access. And this is very much a social impact mission of ours. It's not necessarily to make money, but it's actually to dedicate some of our resources to improving the lives of others. So where we see countries where they can't afford to have access to this, we'll find a way. We'll work with charities. We'll work with government authorities. We're actually a registered social impact company with the Department of Community Development and under MENA, which is the Authority of Social Contribution. So we are very impact focused, and we'll always find a way. And I hope we can create a huge amount of impact in these regions.
We spoke about the future, and we now have Web3. How do you see the integration of healthcare industry or Doctori in Connect in general with Web3 and the future?
So I will say I'm not a huge expert on Web3. I'm
Okay.
learning myself, but I definitely see some promising use cases, especially when it comes to the use of blockchain. I think one is having access to data that we can actually learn from. believe it or not, 40 to 50% of all the data in the world is actually healthcare data. But only 1 to 5% of that data is used effectively enough. We want to get to a point where more data is used to help us learn using artificial intelligence mixed with blockchain technology, so that we can actually start to build models that will help us diagnose faster, will help us understand the local genome, the Arabic genome, in a lot more detail. So right now, when we from this part of the world, we want to get a genomic test done. Those genomic tests are compared to Western genomes. They're compared to European genomes, but there's nothing yet been done to actually analyze the Arabic region, the Asian region in a large way. And in the UAE, obviously, we've got the Emirates Genome Project, which is working to do that for the local population. But having that data to actually learn from is huge. And then the use of Web3 to actually educate people, because we can use the metaverse, we can use virtual reality and augmented reality to actually be more engaging to individuals, to actually want to use it to learn about health, gamifying health for children, so that they actually are aware at an earlier age about health conditions and how to live healthier and make those healthy choices.
Okay. I just want to ask more about one specific point. You spoke about data and blockchain. What type of data are we speaking about, other than the genome data? What type of data would you think we could put on the blockchain? I know you spoke at the beginning about checking your health record, logging in and checking your health record. Is that something we could put on the blockchain, and then having an access to the doctors and the patients at the same time?
So right now, I think that the challenge is always in data protection and in understanding the geography of where that data is held. Right now, I think we're still trying to understand how does the geographic location of that data work in terms of cybersecurity and ability from a regulatory perspective. That being said, as I said, majority of the data is unused, but that's because majority of the data that is collected is unusable. So the general notes from a physician, unless we can skim through it using AI to understand what are the common symptoms, what are the common issues, that free text is currently unusable. The only thing that is currently usable is blood data, is X-ray results, because they're actually reported in a systematic way. So using whatever data is measurable, and we can start to see that conversion from a free text to more of a selection-based criteria, where the data can be analyzed. Right now, very little data is being analyzed effectively enough.
Let's go out of the health tech industry, more of the startup ecosystem. You're part of the Founder Institute, UAE and GCC. Is that right? First of all, what is that, and like what startups do you deal with? If you could give us an explanation.
Yeah, so I was previously a director for the Founder Institute for this region. I've always been passionate about supporting other entrepreneurs, and the opportunity presented itself to support the Founder Institute in the region. The Founder Institute is one of the largest global accelerator programs, and it's designed for early stage startups to get access to the education they need, the mentors that they need, the local support that they need from the ecosystem. So what we were able to do with this was, one is spend time with generally between 15 to 20 startups in a cohort, and work with them to going from ideation to actually launching a company by the end of it, and providing them with access to the best experts and mentors in the space, in the industry that they were part of, access to investors in the region, and the opportunity to present to investors by the end of the program through graduation. This was my main focus on this was again in the health space. So I was supporting the health tech startups that were going through this program, and I still speak to many of them. But it's a great opportunity to engage with global experts. It comes out of Silicon Valley, so you get access to experts from literally across the world.
Okay.
Who've been part of startup ecosystem.
What startups or what companies have graduated and launched out of the program that you still remember?
Wow. There's so many. To name just a few, there was a company called Power Women, which was focused on empowering women to do amazing things. There was a company called Pursue It, which was focused around hobbies and improving access to sports and new activities for children. There was an amazing company in the nutrition space making nutritional products using camel milk called Nomadic Foods,
Okay.
where the founder was using camel milk to actually solve health conditions. There's so many. There's, during my time, we had about 30 to 40 companies graduate.
Okay. Speaking about startups and graduations of startups, do you angel invest? Do you invest in any form in startups?
I have done a little bit in the past. I'm not very active, and mainly because I found it takes up a lot of my time. The minute you kind of list yourself as an angel investor, you suddenly get 1,000 pitch decks across your desk, and then it becomes very hard to screen through them. What I have typically done in the past is been more of that friends and family investor, where if somebody comes to me and says they have an idea, I'll provide them with mentorship and a little bit of seed funding to help them get along the way. But I really need the vision of the company, the values, the story behind it before I would be interested in getting involved.
So is there any remarkable startup you angel invested in or seed invested in that's now well known or went to higher levels in the region?
Nothing notable, to be honest. There is a couple in India that have done some amazing things in the education space. I wouldn't be able to name them yet, but it's definitely coming soon. You'll see some news about what they're doing.
Perfect. Other than the health tech industry, what are some other industries you find interesting in the region, or just for you yourself as a hero that you like, okay, someone should go build that startup in this industry?
Yeah, so I think for me, first of all, I'm very impact focused, and this changed somewhere in 2014, 15 for me. In the past, I was very focused on what's the endeavor that's going to make the most amount of money. As we do growing up, we look at we focus on that first, especially the generation that I grew up through. Now that focus shifted for me, so I look at impact first. That's education, that's agriculture, that's anything that's environmentally. I'm very passionate about the change in transport. Moving to alternative fuels. I'm really interested in vertical farming, how we can kind of gain food security through vertical farming, and of course, health is my most.
Okay. One last questions, and who are founders or like startups in the region right now that you will bet your money on, that you're keeping a close eye to, and you're like, okay, I'm gonna bet on this founder. If you were to have an official fund and you're angel investing, and you would want to invest in a founder or a startup, who would that be?
Wow, that's a very tough question. There are so many, and to name one would be almost impossible. I'll tell you one space I want to stay away from is fintech. I see too much money going there. So and I don't see them doing anything remarkable.
Okay.
But I think anywhere in the industries I spoke about, um, we primarily I would put money in health today. Um, and that there's so many amazing people in the space.
Here's a question. You mentioned whatever is being done in fintech isn't remarkable. What is something you would like to see that would make you put your money in fintech?
Uh, I want to see something that is genuinely supporting people to not just save money and put money, but actually make a good return on their money.
Okay.
And I think, yes, there are some amazing startups doing things like fractional ownership of shares. That's amazing. That's good stuff. But how many neobanks do we need? How many people, opening banks? To me, it's funny how they even get funded because they make no money. They're banking on transaction fees, so it's hilarious almost. But yeah, I think anything that is helping people become wealthier in a structured, efficient way, I think is great. What does need to change is transparency in the industry, and yeah, I think anybody who can help reduce any costs. There are some significant costs involved
Right.
in the space.
Zahir, amazing episode. I really learned a lot. To be honest, when I searched Doctori or Doctori Connect and was doing my research, I had a different idea about what the startup is from what you spoke about. So I'm really happy that we got to speak and you got to share the amazing stuff you're doing and the amazing approach you're taking. Uh, Amazing information. I think everyone should be looking at what you're doing. Thank you for being here. Any plugs in you want to add in? Any information? Anything you want to share? Are you hiring? How could people help Doctori more? Feel free to let us know.
Yeah, I mean, first follow us on Instagram. We're at Doctori Connect. We will be launching offers via our Instagram channel very soon. Uh, Feel free to reach out to me if you are looking to work in the space, where we will be hiring soon. And generally, if you want to have a chat, you want to learn more about what we're doing, I'm on LinkedIn. You can drop me a message. And always happy to help other founders looking to do amazing things in the space. So feel free to reach out.
Sounds great. Thank you very much one more time.